Welcome to you all. Thank you for the prayers. And we have a very special uh, friend here. Ever since I have made contact with Dr. Manaseki-Holland, I feel that I found myself one of the best friends possible. I will go ahead and read her bio for you. Dr. Semira Manaseki-Holland is a pediatrician and a public health physician with 30 years experience of living and working as a doctor, health service manager, policy advisor, and researcher in the UK, Geneva, WHO, HQ, Mongolia, Afghanistan, and Tajikistan, and research and development work across 4 continents. Semira lives with her family in the West Midlands, conducting research in health systems and community development projects in Africa and Asia, as well as teaching in the University of Birmingham. In September 2024, Semira was asked to collaborate with the Baha'is and the mayor in the Isle of Man in facilitating an all agencies conference on services and approaches to the growing problem of loneliness. Loneliness, sustainable solutions to this modern day epidemic, a Baha'i perspective. Thank you very much for accepting Dr. Manaseki-Holland to be with us tonight at this late night, and we know you must be very tired, but we really appreciate you accepting it.
Thank you very, very much. That was very kind of you. And I do apologize again for getting the time differences wrong. Sorry, I just had to confirm something. Am I okay to share my screen?
Sure, let me.
And can you hear me all right? Because I'm not 100% sure the sound is brilliant.
It's very good.
It's okay, is it? Good, thank you. And also, I just want to make sure that you can actually see the screen. Do you have a black thing on here or not really? There's no.
See the full slide, loneliness.
Okay, excellent. Thank you very much. So I won't spend much more time on sidelines, and I'll go straight into this. Kept you waiting long enough. Thank you very much for the invitation. I'm very honored to be with you and to be presenting this this piece of work. As was just read, really it's my background's in pediatrics and public health, and actually I work mainly in poor countries, low and middle income countries, and not much in high income countries at the moment, such as Canada and the UK, where I live at the moment. Loneliness is particularly acute in high-income countries, but actually is an issue globally, and particularly become so after COVID, due to various changes that have come about in our social activities and structures. So this perspective, as I was invited at the time to present this to the people in Isle of Man, which is a small independent state, little island really between England and Ireland, as you know, it's Southern Ireland. Since that time, I sort of looked more into the topic and try to marry it with the activities that the Baha'is do. And my approach really to the Baha'i faith really is that, you know, we are told by the governing body of the Baha'i faith, the Universal House of Justice, that it is always important that as professionals we try to understand the faith and its implications to current issues and affairs as they affect our professions and our lives. And often we feel that perhaps this is not easy to do if issues are somehow perhaps scientific or remote from religious topics or extremely sort of political issues. But actually, I think if we try hard enough, there is always very many ways in which the Baha'i perspective, practices or teachings can address many of our current issues. So this is a current issue that, as I just mentioned, does affect the Western world quite heavily, and has become such a problem that let me see if I can get this to advance, that the WHO has called it the health, they have called it a global public health threat. And they have actually launched an international commission to look into the issues of loneliness globally. If you're familiar with World Health Organization, WHO, you will know that most of the work is actually in poor countries, but they do, of course, address issues that are of global concern wherever we are in the world. So they have also designated this as one of the most pressing public health issues, particularly of our modern day. Although it may, may be an issue that has only just recently become of interest, not that it didn't exist before, but has become more prominent and more acute. So I'd like to start with this slide, which may really ring home to a lot of us. This came from a document, a British government document. You can see down here the reference for it. And the title is up here. It's quite small, but it doesn't really matter. There are many. Are you okay? Sorry, I'm hearing some comments. So in this document, they have a very, very good summary of people at risk of so-called loneliness. You can see in this diagram quite nice little graphic images of this. And actually, if you ask me, I think all of us have either gone through one of these stages or are in one of these stages. And so in some way or another, either we are or could be affected by this or have peers, colleagues, friends, relatives, neighbors who are going through these situations in life. So just very quickly going through this, it sort of spans the age range life cycle of a human being. For example, we could be bullied at school. This is very common, right? But also we can be bullied at work or in our neighborhood as adults. And that will make us isolated, feeling lonely and remote from our people around us. We could be leaving care, a child that has grown up in care and now has to leave that environment is totally remote from the environment they're moving into, probably without support. There are quite a number of adults, unfortunately, in our Western world, particularly, who become homeless. And we don't have a culture of taking people in, whereas in some poorer countries where I work, actually, as poor as they are, people don't sleep in the street in the same way as ours do. We have here, people who may be moving home or moving a job. They come fully into a new environment. There could be young people who, for the first time, going into work, or actually are, just moving their job at the moment. And we could be experiencing discrimination, perhaps possibly due to our disability or due to our race or whatever our background may be that makes us different to others. And discrimination in the environment we're living in. It could be religious, it could be racial, it could be color, it could be, as it says in this diagram, disability. We could be living in an environment where we're in an abusive situation, where you know, whether a partner, a parent, a sibling, or whatever, is actually abusing us. It could be a colleague at work or so on. We could be a victim of crime and feeling isolated within that environment. We could be becoming a parent for the first time and or second or third time and have basically no possibility to meet any friends and no one bothers asking about us. We could be a carer. This is now a very common situation in the West where even children can be a carer for adults because the proper social services may not actually be in place for us. And as carers, we become isolated, unable to even socialize. And again, other people forget that we are still in need, even though we have a lot to do and care for somebody. This living with disability is not just about discrimination, but it could also isolate us just by mere fact that we can't move around so easily. This could come about by age or any other reason. So we could be, for example, somehow change, you know, the connections change and we become isolated. So for example, we are at an age where our friends are all getting married, and we are the one that aren't, and we sort of left out of that whole social circle. There could be issues of divorce and relationship change, again leaves us isolated and in a situation of life change. We could be, nowadays we hear a lot about it in the news, actually minority people. We could be a refugee or asylum seeker awaiting some kind of you know, result in our life and totally isolated in the new environment we're in. We could be moving into care, not coming out of care. We could be actually moving into care as an elderly or disabled person. And again, into a new environment, away from people we know and love. Retirement, whether we are moving into care or not, itself, it can be quite isolating. We may have a routine every day, get up certain time, go to work, blah, blah, blah. Now we can't do that. And we become affected by that issue of, you know, change of life, if you like. Children leaving home is another common environmental situation where parents, you know, we call it empty nest, right? At least we call that in the UK empty nested, this picture here. And this empty nestedness can be quite isolating for parents who spend all their life in a particular role and all of a sudden they don't actually have a social circle to fill that gap. We may become a victim of some disease condition. Now, again, also very common in high-income countries where we're living into older age, but actually have got various diseases and conditions to cope with. And that could isolate us from others, either because we can't get around or because we have to go into, you know, some kind of treatment regime, you know, dietary regime and all sorts of things. And bereavement, of course, as well, is a very common one where we lose a loved one very close to us. And, you know, again, that isolates us from our routine, our companion, and leaves us in some kind of a vacuum. So there are many, many situations. This is just a sort of a summary of some main ones. But as you see in here, all of us in some ways have gone through some of these life events that can make us more likely to feel lonely. So we come back to this note from World Health Organization that in 2023, they launched an international commission. This commission said that the health risks are as bad, health risks from loneliness are as bad as smoking up to 15 cigarettes a day, and even greater than those associated with obesity and physical inactivity. So again, that's something we're very familiar with in high-income countries, in Canada perhaps, and in the UK, and similar settings where, you know, one of our biggest issues is obesity, is lack of physical activity, again, smoking or various other use of substances, which are, you know, sort of lifestyles we have adopted, which are unfortunately harmful, and cause conditions like diseases of the heart, of the lungs, cancers, and so on. So if you imagine that all those bad things we hear in the news are actually just as bad as loneliness, it can give us a perspective as to how severe this problem is in society. The feeling of rejection by society, so by our peers, by people around us, apparently, through scientific investigations, triggers brain responses that are similar to physical pain. It's not physical pain, but they're similar in terms of the stress triggers we have in our brain that are similar as though we were in great pain. So this loneliness has been linked to mental health and issues and depression, early dementia, heart disease, stroke, and early death. So these are very physical outcomes. They're not all about feeling depressed. Often we think when we're lonely, it's just going to make us depressed and sad. It's not only about depression. That's only, if you like, the first line, the one that we easily associate with loneliness. It actually has physical outcomes. So just as an example, there are many, many studies on this topic. Some of you may be more of an expert than I am. Maybe you can tell us more during the discussion. This, for example, is a publication. Sorry, I have something here I have to move so I can read what there is. In 2023, in the journal Nature Human Behavior, which is a peer-reviewed journal, we call it, as most of you would know, that means basically a kind of a scientific publication where other similar kind of experts read the document and approve it before it's published. And this is a methodology called a systematic literature review and meta-analysis, which again, it sort of means that they have found as many pieces of research as there are out there through systematic way of looking in the literature, and summarize the results of that. So we're not talking about one study, two studies, or whatever. We're talking about all the studies that have been done on this so far. And in this particular study, in this particular research, they have found 90 cohort studies. Cohort studies means studies that people have been followed for a period of time to see what the effect of something may be. And they have these 90 studies in one way or another looked at social isolation, loneliness, and its effects on physical health, not mental health, but physical health, and particularly on mortality, which is death. Obviously, this is a big paper, and there are several others like this. And the summary of this is, we'll just go down here. They looked at all-cause mortality, that's all reasons for dying, whatever the reason for that person dying. And you can see that there is a significant, so the findings of this paper basically showed that all of the things they looked into virtually were increased in their risk in people who were isolated or lonely. There's an overlap in that definition, of course. So for all-cause mortality, that's dying for any reason, there is a significant increased risk. I mean, I know that this figure needs interpretation. We don't have time. I can do this later if people are interested. But it's just to show you there's a real science behind this. A significant increase of death of any cause for people who have this kind of situation in life. There is increased risk of dying from cancers, increased risk of dying from CVDs, cardiovascular diseases. So that's mainly heart diseases, but includes diabetes as well. And there are a lot of details in this paper. If anybody's interested, you can look it up. You can just Google it, it comes up. So that was sort of our evidence that this is actually a bad thing. It's not just about depression, but it's about something that affects our health all round. Now, what are the solutions for this problem? Obviously, it is a multifaceted problem. Why we saw from that diagram why people may be lonely or depressed. There's no one reason for it, but there are principles that we can explore, and whichever of those situations one is in, there are things that we can do as individuals and as a community to prevent that, just like any other condition in life. But let's first explore some critical principles related to this issue of loneliness and its causes and solutions. Loneliness obviously has a social dimension in that we are isolated or somehow from others that we love and want to be with. But that also relates to a feeling. So isolation is a condition that is external, whereas loneliness is a condition that's internal. It's a feeling we have. As you saw in some of those environments, you could actually be living with other people but feeling lonely because of the way you are treated or because of your circumstances compared to those other people. So it's not a literally being on your own in an apartment situation. So in that case, I think apart from just looking at our environment externally, we need to also look at the internal factors that affect man, humanity, individuals in that feeling of loneliness. So in the Baha'i faith, we are told that the reality of man is actually threefold, three-faceted. And I've sort of added the fourth one, which also is in the Baha'i writings, but doesn't usually get called at the same time as these other facets. So the three main facets that we often hear about is physical, our physical body, our intellect and mental self, and there's our spiritual soul and spiritual self. But also we are told that we are social beings. We're not isolated animals kind of beings. And that all of these facets of human existence need somehow nurturing and need, if you like, feeding in a different way. This is not just in the Baha'i writings, of course. This is also now in all sorts of human health sciences and of course all religions more or less say the same thing. So what is food for the physical facet of being a person? That's, of course, just physical food. But also to nourish that physical body, we need exercise and many other things. This is, for the physical body. For the intellect, we have our education system, whether it's schooling or just, growing up in a community that passes on knowledge and stories. It is the crafts and arts around us and perhaps the occupation that we end up and the role we play in our society immediately. This is not just about having literacy and qualifications. It's about whoever we are in life. Somehow our mental and intellect self has to be involved and nurtured for this. Then we are, of course, all social beings, and we have a family usually around us, friends of some sort, a community of some sort around us. And most of us would say that there is also some aspect of human beings that are not so tangible, whether you call it soul or spirit or reality of man. And that also needs nurturing. And the trendy word, the fashionable word now is mindfulness. If you're from any religion, you would call it prayer and meditation. It's a thing we've been doing for about thousands of years as humanity. But also you nurture this soul and spirit, not just through meditation, but also through faith and through service to community and all the virtues that we are told to practice, and often maybe we don't even see a sense in it, but that nurture that soul. So in terms of solutions for loneliness, which is a very core feeling in human reality at the moment, or for the person who's lonely, all these four dimensions need to be addressed, and they are linked. And in this presentation, I'd like to challenge that certainly one way to look at this as a solution is that there is one path of action which can nurture all of these and is promoted in different forms actually by all faiths. So, and that is the act of service or act of kindness kind of teaching or path of action that we are encouraged all to do in all faiths and belief systems. So almost all faiths and belief systems, even if you live in a tribe in Africa or some kind of a remote faith in parts of the world, have what we call golden rule, which is sort of be kind to your neighbor, love mankind, love humanity. Some form of that kind of teaching exists in all faiths, and whether you have a faith or not, it is called the human principle, a humanitarian principle, whatever name you want to give it. This idea of service to others or to the community we are living in, again, however way you define that community, in its small form is your family, it could be your neighborhood, your village, your whole country. And I would like to propose that this potentially can benefit all four facets of human nature that we just discussed. So I'll come to that, but the point also I'd like to make is that this not only just helps the person who receives this act of kindness, but also helps the person who's giving or offering the act of service and kindness in terms of all those facets of human existence, but also for loneliness. So practical examples of service that many of us may do even without thinking about them is simple things like if one of our friends is sick or neighbor is sick or relative is sick, we might do their shopping, we might do their cooking, and we might do cleaning in our household because, our mother or our I don't know, whoever normally does it can't do it. We might help with DIY and gardening. We don't even ask. We do it because it is a kind of what we do in our family. We share the activities. It could be, during COVID, we had quite a lot of this happening in the UK. I'm sure you had the same, where, neighbors who were elderly or for whatever reason couldn't go out, we would shop for each other. People came together a lot more. So there was a lot more of these acts of sort of doing things for each other. It could be just simple things like, many people as Baha'is, for example, when we go to meetings, we often give each other lifts, right? Anybody who wants a lift, can't get around, hasn't got a car. So, this is a kind of simple service. In the Baha'i system at the moment, we have this term called home visit. So basically, visit people, around you who may be isolated or you haven't seen for a while. In UK, we tend not to be so good at just calling in onto people, some cultures you don't even need to tell anybody. You knock at the door, they're home, you go in. In the UK, you often have to say, oh, hello, are you in? Maybe a week in advance or something like this. But, we are encouraged to make these home visits, whatever your setup is. Sorry, this advanced without me wanting it to. Hospitality, simple things like inviting people around, holding events in your home, perhaps for neighbors who are not so able to go out anywhere else further. And this whole issue of accompanying other people in their endeavors. So we might call it at work supervising, or in university and school, teaching or supervising somebody in their project. That is a kind of service. Of course, if you paid for it, it's not much service, but we do that often in trying to help people who have come for the first time to some activity, often again without thinking about it, but it's a kind of service. And many daily activities we do could be categorized as service, and we may not even think about it. But there are also, again, in the West, more common than it is in low-income countries, this whole concept of NGOs, charities that have opened up and people offer up their time to do various work or fundraising, what have you, for charities, whether they are national or international people we've never met. In low-income countries, we have the concept, I don't know if you have this even in Canada, we don't really have it much in the UK, where individuals in neighborhoods are asked to be volunteers for development and health care, particularly. They're given a very little training and they visit families to ensure their health is good. And actually, they get very, very little return for that. It's a kind of service to their community. There are obviously many ways that we could be doing service for others or acts of kindness. But the if you like thesis of this talk is that embracing a life of service goes beyond moral and spiritual considerations, as it exercises intellectual qualities. You have to think about, you know, even if subconscious, exactly what that person needs and what you're able to do and how you can organize yourself to do that, and possibly even gain skills to do that service. And it has mental and physical health benefits. So, for example, we have now quite a number of pieces of research that shows that this idea of serving others has neuropsychological benefits. So I have another paper I'll share with you. This is some interesting short summary here. There are, as I say, you can Google these. It'll come up. You don't have to be a great scientist to find the evidence. So there is, for example, cortisol. Many of people have heard of cortisol. It's a hormone that our body produces, and it's generally called a stress hormone. So when we are in stress, when you know, fight and flight kind of hormone, this levels of this cortisol, which is a stress hormone, are reduced, improving stress, mental and physical health, because cortisol also affects your physical health. You get palpitations and many other things. So there is evidence that this kind of, you know, life of service to others, it's called altruistic behaviors. People who have regular altruistic behaviors or acts of service have reduced cortisol level. On the other hand, they have increased what's called oxytocin hormone, which perhaps mothers would be more familiar with as a bonding hormone. It's called love hormone. It's the hormone that's produced when the mothers feed their baby. When the mothers first give birth to baby, it is highly increased. And this particular hormone is shown to be increased in these people, fostering a sense of connection, happiness, and well-being. That's for the individual that's doing the act, right? Not the person who's receiving service, but the person who's doing the service. It's shown that people who have consistent altruistic behaviors have increased lifespan. Altruistic behavior improves immune system and overall resilience against disease. Overall reduction of certain disease rates. So I'll again summarize this by showing you a summary piece of paper, a sort of scientific paper that summarizes all this so far anyway, of the literature, of the evidence. It is a paper again from 2023. These are the authors of it. It's called Exploring the Effects of Volunteering on the Social, Mental, Physical Health and Well-being of Volunteers, an umbrella review. Umbrella review is a bit like a systematic review. They have this very interesting diagram that summarizes all the effects. They found 18 review documents, so that those papers already had other studies in them, and 30 unique studies that were conducted at the time this was done. And all the studies supported a positive effect of this altruistic behavior, which was statistically significant. Particularly in this one example I'm giving you here, 30 out of 30 studies were statistically significant, very strong evidence, highly consistent effect size. And it was the second largest outcome that they, effect size for outcome that they found in its magnitude during their analysis. And this was particularly to do with mortality, with death. So showing that death rates or effects causing death are reduced by these behaviors of somehow volunteering for those people. So now you can have a brief look at this diagram. I'm not sure if it's very small, whether you can read it or not. It's just demonstrative here. And it shows basically aspects in our physical health, psychological health, physical health, general well-being, and social well-being that are affected by these volunteer acts, regular volunteer acts. You can look at definitions and so on in this paper if you're interested. Again, you can just Google this, it'll come up. And these little colored initials you see show the strength of the evidence. So VW is very weak. So overall mental health, actually the evidence was the lowest for the person, for a volunteer. The effect was more on physical health. You see this very strong VS, the very strongest evidence that they found was for mortality and for independence and disability, increasing independence and reducing disability. So S is strong, M is moderate, and W is weak, and VW is very weak. So you see that actually all of these well-being things they looked at, there was some evidence, but stronger for certain things. Again, we don't have time to dwell on that very much. The reason I thought it was really useful to do this, actually, this exercise to show you scientific evidence, is that often we think that religious teachings are not of much consequence in our modern world. And often we don't understand the wisdom or purpose of some religious teachings we have had for centuries, for thousands of years perhaps. And this golden rule of serving others, loving thy neighbor and all of that, is actually something that we've been told by all prophets and messengers and philosophers of the past. And only recently looked at its actual scientific impact. And as you just saw in this presentation, which as I say, you can find papers for this, actual research, original research evidence for this, is that it has tangible, measurable change in our body. It's not just about being a good person. So what are some of the characteristics of these acts of service? Obviously, there's many. This is just the obvious ones I've put on here. I think the main point people make is that it needs to be altruistic, sacrificial somehow, not so much of benefit, perhaps apparently, to the person who's doing it. So I think I'm breaking that code here by telling you it has benefits. But even if you don't know it has benefits, you do it out of love, out of that sacrificial approach to your life. It's usually unasked, you just think about it. If this person has a need, I should do it. It should be heartfelt. It usually is heartfelt because you feel some kind of affiliation or some kind of feeling for the need to do this. It somehow marries up with our human and spiritual values, whatever our background, as I've just mentioned. It is needed. It's not something that's a menace to the other person. It is something that's of benefit to that person. And I guess it doesn't really count if it's our daily work, although depending on what your daily work is and how sincerely and lovingly you do it, that is also a kind of act of, we've been told in the Baha'i writings that any work done in the spirit of service is the highest form of worship. So our work, if done with love and contentment, potentially falls into this, but usually, at least in the scientific research I was telling you, it is unpaid work. And so sorry, my spelling here has gone wrong. How does the acts of service work? How do we nurture acts of service? This is supposed to say nurture. We really, to make this a solution in our society for this epidemic that WHO calls it, I believe that we need sustainable solutions, and in the Baha'i approach, we would say both at the individual level and community level, and of course institutional level. So yes, we can say that government should set up various services, but in here we're not talking about that. We're talking about a change in heart and mind of every one of us that can help us not to be lonely, but also help others not to be lonely. So again, time is limited, but I'll go straight into something most Baha'is would be very familiar with, actually, in whichever part of the world we are living in. I believe most people here are Baha'is, but I believe also there are some who are not. So for the benefit to those who may not be so familiar, Just briefly, as you know, Baha'i faith doesn't have clergy, sort of priesthood, and we have an administrative system that is mainly an elected system of institutions and administrative bodies. People serve on it voluntarily. And that this system, this administrative body, comes at local, national, international level. And these bodies, certainly at the international level, called Universal House of Justice, every so often come up with what Baha'is call plans, which are essentially modes of activity promoted globally with the Baha'i communities that are then interpreted in their own way at national and local level by the local and national institutions. So the current, or for the last perhaps 20, 30 years, the current model, the global model that the Baha'i faith has been trying to promote for all the Baha'is around the world to do the way, if you like, that suits them and their culture and country and activity, is this mode of the Ruhi Institute process, which essentially asks for building neighborhoods that have certain characteristics. Service is at the core of this Baha'i model. And it's said that service is core to development and growth, both at the individual and community level, and institution, actually, which I'm not covering in this talk. So we are reminded that building neighborhoods in this particular model of course, has many dimensions, but is particularly important in terms of nurturing unity, my apologies, you should say unity, in diversity, which basically means bringing together communities and individuals in small scale neighborhoods. Neighborhoods, may join up to become larger units, but at least at neighborhoods, embracing the diversity of people that live there, and to be inclusive of all of them, to enable, if you like, universal participation rather than leaving people behind, which also is, by the way, a United Nations goal at the moment. Raising the spirit and spiritual atmosphere of that neighborhood. So not just talking about having get-togethers or gossiping every so often about each other, or children playing in the play yard, but about activities that help this unity in diversity and help to nurture the spirit and soul of that neighborhood and individuals within it that are deep and meaningful, and have somehow can bring together this diverse, perhaps multi-faith group of people. That this building neighborhoods becomes possible through practical means of building skills in individuals in that neighborhood, for skills for service and community action. So again, that could be very different depending on who we are. If we're somebody with disability or unable to leave home, it could simply be just calling somebody to see if they're okay and just having a chat, or praying for people, or looking out the window and encouraging the children in the street, or something very simple. If we are a more able person with more time, it could be all kinds of things in terms of building places, offering classes, offering gatherings, or all sorts of things. So this building skills is core to this Baha'i concept of Ruhi Institute and neighborhood building, which ranges, as I said, from very little action of acts of service to really huge offerings of time and resources of individuals who feel moved to do so. And ultimately, that these three components would require and contribute to a raise in spiritual and intellectual capacity of individuals within that neighborhood. So actually, as I said before, a little bit is sort of like a chicken and egg. If we can do these things, it helps us develop spiritually and intellectually, rather than sitting at home and either praying or meditating all day or reflecting on our own yoga activities and going on retreats to develop ourselves. As good as those things are, focusing on self does not necessarily help the individual to grow. But by helping our neighborhood and our society, by offering these acts of service, we can actually develop intellectually and spiritually ourselves as well. So the tool for this model of building neighborhoods in the Baha'i global model, if you like, is this Ruhi Institute process. And just very briefly, for anybody who may not be familiar, is that it essentially is the kind of series of books like this. There is now many, like 14, 15 of them. And essentially they are participatory. One of the books, by the time you've done the book 7, you become a tutor yourself. If you've done book 5, you become what's called an animator for young people. And there are components of this Ruhi Institute process for children, young adolescents, youth and adults all alike. And the basic training material, which is this and other books, are informal, and they're supposed to be run by these informal tutors, not necessarily by trained paid individuals. And that anybody, it's participatory, anybody can take part in this, either as participant or as a tutor, can initiate one, and can have it in a home, in a center, in street, under the tree, whatever is good for you. The whole institute process promotes the concept of creative arts. We know creative arts, whether they are performing arts in singing, a drama, or whatever, or they are sort of written arts in terms of doing artwork, drawings or paintings or whatever, or textiles or so on. All of these creative arts, poetry and so on, are very much encouraged as part of that developing the spiritual atmosphere and creative unity and diversity aspect of neighborhoods, and as part of this process. And in the core of every single one of these books or training materials or processes, there is the notion of how do we build a skill or develop a notion of action and service to others. The whole process of Ruhi Institute also has what's called a posture of learning. So the idea is not that I think of myself as the great tutor or animator, but that I have a posture of learning, as in how can I learn from those participants? And, what do they bring to my learning and to our group learning? And also how can our community, our neighborhood come together every so often and reflect on how we're managing on all this? And how do we advance this process? Now, obviously, that is the perfect model. And every community addresses this in their own way and approaches achievement of this wonderful goals in the way they can. But these are the principles for now. In this Ruhi Institute process, we are reminded that the process is supposed to enable individuals and communities to tread a path of service to humanity, not just to Baha'is. To our neighborhood is a part of humanity, but of course doesn't just have to be our neighborhood, it could be anyone bigger than that. But this concept of service, that the whole process of Ruhi Institute is supposed to help us tread the path of service. And that by doing this, by treading this path of service, we are pursuing a twofold moral purpose of life. So in a way, this Ruhi Institute process of the Baha'is defines the purpose of life based on Baha'i teachings, which comes down to this service. So, of course, all religions and all people talk about, and to some extent do more or less, of this looking after our own growth and development. So this also talks about to attend to one's own spiritual and intellectual growth, but also to contribute to the transformation of society. That is a twofold moral purpose, to look after ourselves, if you like, and our own growth, not financially, but intellectually and spiritually, and to see how we can contribute to transformation for better of our society, our neighborhood, our whatever, the world we live in it. And the concept that is promoted in the Baha'i teachings and this Ruhi process is that these two are interconnected. So I can only grow if I contribute to transformation of society. And society can only grow if I have intellectually and spiritually grown in that process. I find this very beautiful concept, actually, and very wholesome in that it brings together a lot of things that we are told either at school or in our family life, and also spiritually if we have some spiritual inclinations. And an easy way to say what is the purpose of life to our children, our friends. So in this concept, what are the enablers for unified, effective action? Now, remember, we're talking about loneliness. So loneliness, remember, had spiritual, intellectual, and social components, as well as physical. We talked about the physical side, that if we can somehow address the loneliness and in fact do some service, we have improved our physical side. So we leave that aside for now. But you know, that actually if we can improve our spiritual and intellectual growth and this transformation of society, somehow through this process of activities at neighborhoods, of course, whether we are a participant or we are active in that process of service, we can't by definition be then very lonely because we are engaged with others. I would also argue actually that by being engaged with others, somehow you're physically active. So you're feeding your physical body. You have to think about what you have to do and how you can manage your time. That, you know, at the very basic level, that is your intellectual side. And your spiritual side is the values that you're adopting and the service that you're giving. And your social side is, of course, the fact that you have to interact with others to develop your communities. So what are the enablers for this unified, effective action in this Ruhi Baha'i model? Is if you remember that I mentioned that there needs to be cycles of unified and unifying consultation, reflection, and action within this model. So every so often, this community, whatever size it is, needs to come together. That is itself a unified action, and it's also unifying. If they can then have a process of consultation, which in Baha'i sense also has quite a definition we don't have time to go through, and reflect on how they manage their acts of service and development of their community, and then, you know, learn from that and act further. That learning posture I mentioned earlier. There needs to be some kind of a coordinator, so it is very practical, some kind of a facilitator who sort of encourages and brings people together. This is all voluntary. It needs to be inclusive and driven by grassroots skills building at community members. It's not about some professional coming and doing everything. So even this community coordinator person is not a designation necessarily in many communities. It's just somebody who has the time and does more than others. So it's not about a professional approach, you know, it's not paid work or anything. And that this needs to include an elevating of the atmosphere, spirit of neighborhood, as I mentioned earlier, in terms of the projects or activities that are being done, somehow beautifying meaningful conversation, mindfulness, mindful of others, service-orientated, and so on. Covered that already. And people ask about resources. Actually, within the Baha'i system, as I said, this is thought to be important, to be somehow voluntary, and really 99% of this whole process is not funded as such, but it is people's individual time and love that is given. But there is this concept of deputizing or year of service. So within the Baha'i community, at least, Baha'is encourage individuals to give up a year or a period, it could be a month or longer, to actually, you know, do this period of service where they dedicate themselves to this Ruhi process in their own community or another community, or if I'm really unable to do that, either because I'm really busy at work or with my family, or I'm not well, or whatever reason, but I have some funds, I can help others to take this period of service, because anyway, they have to eat somehow. And, you know, not everybody who can offer a year of service has got the means to be able to feed themselves in that period. So there is this concept of deputizing. And, you know, somehow some people may offer funds, but on the whole, this is a not funded process, which also is quite incredible if you work in community development, either globally or within our own Western countries. So I come back to this image that we started off with, that if we have this notion of community building, actually we are addressing then many of these circumstances, because, you know, if in my neighborhood we have a group of people who are aware and cognizant of the needs of others and service orientated, even if it's not everyone engaged in that, then that small body of people would be very much more aware of individuals who in any of these circumstances maybe lost someone, loved one, perhaps, you know, going through relationship problems, or lost their job, or coming in and out of care, or have become a carer, or just a parent that's isolated, or any of these things. I mean, we may not know if someone's bullied, but 80% of these we would be aware of, and we can either respond to them, or if we are an individual in those circumstances, and we have this notion of a life, of the approach to life of service, then actually we can help ourselves better. So, for example, a retired person may say, okay, I'm retired, but I don't have to sit at home, watch telly all day, or play golf all day. I can actually see what people around me may or may not need. And that, by definition, will get them involved with others and at the house, and, you know, physically active, mentally active, and spiritually active, and socially, you know, in contact. You know, if I'm moving house, if I have that approach, I knock on my neighbor's doors. I don't wait and see if anybody will come and welcome me into the neighborhood, and so on. So I think that approach of service helps both the person who is lonely as a recipient and the person who is doing the action, because they will find ways of getting through their situation much easier because of that approach and mentality to life. There are great examples. I believe you have quite a number in Canada, of the application of this principle of Ruhi Institute and the global approach of Baha'is at the moment, where total communities have been transformed, and really have, you know, young people's lives have been changed, other people's lives have been changed as a result of these activities. So there are, you know, some videos I'm sure you've all seen, or you could go and look at on website. If you Google Baha'i films, you'll see a number there, and these two particularly have examples of these countries in a bit of detail, like 15-20 minutes for each of the examples, where the communities themselves explain what's been going on, how it's helped or affected their lives. And you see there is an example from Canada, I believe it's Toronto, and you know, one from US in this one. So I'd like to end with this slide, that of course solutions to loneliness are multifaceted. One approach I would like to put out there is the Baha'i model, which aims to be unifying, growth-orientated, inclusive, and a sustainable approach, without the need for funding, and involving all who are basically living on this planet if they choose to be involved. And the basic motto of the Baha'i writings, which many of you would be familiar with, is very pertinent to this approach, and that is, so powerful is the light of unity that it can illuminate the whole world. Thank you very much. I do apologize for the late start again.
Thank you so very much, Dr. Manaseki-Holland. If people have questions, not comments, but questions, please raise your hands. I have a few questions myself. I was wondering if you can share with us some information about the conference that you in 2024 did in the Isle of Man for all agencies. I want to know how people dealt with it, and I want to know the result of it. But let's go to Arman
I
Khani.
would be delighted to hear comments as well, not just the
So
questions.
please make comments, friends. I take my word back. So Arman, go ahead, please. Where are you joining us from? Where?
سمیرا جون الله پا الله پا سمیرا جون الله
Alapa, Alapa.
حال شما خوبه؟ من طاهره خانی مامان میترا هستم.
Oh, very nice to meet you. Hi, how are you?
دکتر مناسکی روح شاد.
مامان روحش شاد. یادتونه منو؟
Not to be
دریانو همسایه میترا خانی.
Jonah, I'm sorry. I don't know if you remember, I left Iran when I was 12.
I know.
And
مامان روحش
my
شاد.
memory is not the best, unfortunately, but I'm so delighted to meet somebody who knows my parents. Thank you very much.
همسایه مامان دریانو با میترا خانی هم کلاسی بودین شما. خوبین ان شاءالله شما بچه‌هاتون خانم شوهرتون خوب.
Thank you very much.
ما خوشحال شدیم دیدیمتون. می‌خواستم
Thank you very much. Thank you very much.
so much.
Maybe we can communicate later. Thank you for so the lovely family here, just for context for others. I left my family in Iran due to persecution of Baha'is when I was 12. And I didn't go with my family. My family was still in Iran. So I think this wonderful family here knew my parents.
Yes.
And I went to children's class with their daughters. So this is a wonderful thing. I don't have any relatives.
We love you.
I love you.
In the UK.
به
We love
وجود
you.
افتخار
We love you.
میکنیم.
خوشحال شدیم که
Thank you very much. Sorry about
آقای
Thank
روح
you.
اعتقاد داریم.
diversion.
مامان خوشحالن الان شما با روحیه با این خدمتی که داری میکنید
دستت درد نکنه.
مثل نوری.
لطف دارین. Perhaps ببخشید لطفاً این صحبت ها رو بعداً بکنیم که شاید دیگران خیلی علاقه نداشته باشند. ببخشید.
در پناه حق باشی. خدا حافظ.
خیلی ممنون.
میبخشید وسط صحبت.
خیلی ممنون. خداحافظ شما.
Thank you. It's always wonderful to see the friends of our family, and sometimes they don't speak English, and that's what we have to accept. Thank you, and we appreciate Mr. and Mrs. Khani for coming to this Zoom. Now, if there is any questions, please go ahead. Alice, don't go away. Alice, just stay put. Shu, why are you laughing? Please, friends, feel free to
I love
ask.
you.
Me too.
So shall I maybe start by answering your question?
Go ahead, please. Go ahead, please.
I must say I can't hear you, I think, as well as you can hear me. Something about my laptop. I normally put a headset on, but I don't want to do that really. It's not very nice. So if I understood your question right, you were asking what happened with the Isle of Man conference and activities, right?
Yes.
So, I mean, it was fascinating, actually. It happens not very often that mayors and politicians go to, members of communities for their activities and their, let's say, their vision. So the Isle of Man mayor is a lady, and she comes actually from, a humble community in Isle of Man. And when she was appointed or elected as the mayor, she wanted to identify issues, and in consultation with various people, and particularly wanted to, the Isle of Man doesn't have many Baha'is, but it does have a small community. And in consultation, they together, there are places in the world, I think Canada is one of them, where the political system do come to actually consult with Baha'i institutions I referred to. And these Baha'is were involved in community action, what I referred to in the Ruhi Institute, and so somehow became involved with the mayor, and the mayor asked the Baha'i community for their input after understanding of this kind of Ruhi process that they have globally. So their vision of the mayor was to essentially have all the people that could be doing anything in Isle of Man, that is organizations, to come together and look at how they could share resources or what approaches they could have, given there can't be much more funding, and to be able to improve the situation and to understand and improve the situation. So then together they, if you like, this was part of the social action contribution to society the Baha'i community offered, was to organize this event, to offer a speaker, to organize the activities, invite all the various charity and NGO groups and government groups that contribute to any services within the community. So as you know, mostly a lot of people don't think about what individuals can do, the kind of things I was presenting. Normally they say, oh, well, it's the government's role. They need to have, coffee mornings. They need to have old people centers. They need to have homeless centers and all this. So these are all very official activities. And yes, we do have, in Isle of Man and UK services that, are provided, but often these services are not enough. And many times individuals don't actually feel that those services are very personal. They are not, targeted out of love. They are targeted because people have got a job. Perhaps an NGO, a charity person has started that initiative who's given their life and soul, but everybody else is an employee. So it's not quite the same. And also it's very expensive to provide these services. You need places, you need money for providing the tea and coffee at the very least, the transport of these people and so on. So actually doing anything in a sustainable way, as I was saying, is not easy. And so the purpose of this conference, there were, I believe, all the people that agencies they wanted were represented, but it wasn't for general public. It was basically for government or charity or NGO organizations that existed there. And we started off with this kind of presentation, very similar to this. Not so much on the Baha'i perspective, as I've explained today, but that was also presented. And the idea was for everyone there to share their own experience together, have some workshops where they would say, well, how can we make better use of our existing resources, put our efforts together, this unity in diversity, can we come back together to review this, rather than just saying, well, what can the government do for us? And yes, I mean, it was a wonderful experience. I mean, for me personally, anyway, I didn't know very much about Isle of Man, but yeah, it was a great experience. I mean, I'm hoping my information is not even a year yet since that event. It's about 8 months ago, 9 months ago, and I believe that they are basically getting on with it, and they're planning another event in the next year. I'm hoping to be able to go back. I was very flattered personally, but also very pleased to see a mayor really taking this initiative, and it's a lady mayor, and she'd broken a lot of the mold of the past of the way things were done. So this is great, that we have politicians who are willing to take these paths of unifying approaches. I don't know if that answered your question.
Yes, of course you did. I have another question, but I would like to read for you what we have in chat. Isabel writes, loneliness is more developed is in more developed countries. We also have whole countries that isolate themselves, making it, in my opinion, more important to reach out to everybody, to people everywhere in different helpful and friendly ways. International forums like this at grassroots also makes us feel connected, and that we can learn and appreciate and love each other. So delightful to witness your integrational reunion.
Yes, totally. I agree. That's a wonderful comment. Yes, you're right. I mean, as I said earlier, that World Health Organization does remind us that actually loneliness is a global issue. And whether we're poor or rich in poor or rich country, actually, you know, we can be in any of those circumstances and feel isolated and lonely. As we know, actually, sometimes the richest people are the ones with greatest problem. You know, they feel isolated, they feel, you know, not in a situation where they can even trust anyone. And, you know, we know the highest rates of suicide, stress, and depression are in people of the sort of, if you like, professional, richer class. So it's not about being poor, but also poor people, yes, can experience that very, very much in our own communities and in poor countries, especially through discrimination, through, you know, perhaps disabilities and so on. Absolutely, it's really important to be able to support everyone. And that's why I felt that this Ruhi process that's global and is not limited to any one particular type of community is a very sustainable way of approaching this problem. Because as I say, by doing service to others, you yourself are engaged, actually. It's automatically, by definition, solves a problem for me and for others if I'm engaged. But it's only an example. There are many wonderful charity groups and community organizations that can provide that opportunity for people to be active in terms of service. You don't have to be in the Baha'i community.
Dr. Manaseki, are you saying that our contributions to our fellow men, to our community, should have different conditions, wholehearted, detached, all those things that you put it on the screen for us to feel good? So if I am kind to the neighbor, so he comes and fixes my computer, I won't feel good about it?
No, not at all. I think a lot of these things we do come naturally, right? We don't even think about them. And that's what makes them sincere and have the effects they have. I don't think, well, I don't know if they measured that, but I would have thought when they say it is altruistic behavior, it's not that the person sitting thinking, you know, if I do this, I might go to heaven and have better mental health. You know, most of us that are doing that are doing it because we want to do it. But actually, you know, it's also a way of life, a mentality, which by the way we are exposed to in our society, or perhaps as we grown up, we may adopt or not adopt. You know, attitudes run in communities and in families. We can tear away from that tradition, or but you know, it is a kind of mental state. It's a kind of approach to life. I don't think it's about. I think it's about being genuine. That's what I understand. Doing things not because it's well calculated, whether it's financial reward or non-financial reward, but doing them because you want to do them, because you believe doing service is a good thing, and you see the need and you react to that need. As simple as that, I think.
Thank you so much. Can you share the presentation, if possible, in chat box with, well,
So I can send it to you, Forouzan, and you can do what you like with it.
absolutely. And friends are asking how to access this particular meeting. All of our meetings are going to be on YouTube. I'll put the link on the chat in a matter of a second. I'm just waiting to see if friends have any questions, because I do have a question, and that is when you gave a presentation in London in February, you talked about your trip to Iran and the fact that I asked you this, you told me you don't remember it, but I'm asking it anyways. Um, I I want to know, you talked about the friends' resilience in Iran and the whole idea of leaving a 12-year-old in England and go back. I was just wondering if you can share some of that with us.
So
Very
I
good.
can't remember what I said then, but I'm more than happy to share my experience, of course. Would you like me to do that now? I'm just looking at, there is a hand up.
Yeah, let's wait. Let's see. Peri Khanum, go ahead, please. Where are you joining us from?
Hello, I'm joining from Chicago
Very good.
at the
Welcome.
moment. Thank you. So I have a question about experiencing loneliness through grief.
Sure.
The absence of a key attachment figure, somebody you've been so close with for so many years, a partner or a child, in my case, a partner. How do you deal with that? Because you're not necessarily isolated, but you miss the person that the person that was so instrumental in your happiness is no longer there. And everything that I heard from loneliness, doing mindfulness, being engaged in service, you do all of that and you still miss the key person in your life. Do you have
Yes.
any comments on that? Any
Yes, it's a
advice?
difficult one. Yeah, yes, of course. I mean, all of those circumstances in that diagram that I mentioned, bereavement was one of them. They have their own issues, particular issues that ultimately have a process to go through and need to be dealt with. But if we don't respond in a generic way, no matter what that specific problem, actually it can heighten the effect of that problem. So like you say, I'm answering this in two parts, if you don't mind. So I think the first part is what you said, about mindfulness, being engaged, meeting people, making sure you have a purpose, something that takes your, one's life in connection with others that are positive. So again, don't have to be bereaved. You can be many of those things on that diagram that is not physically isolated, but actually is isolating. And by our own actions, we can try to prevent that isolating kind of environment. But the core problem maybe has its own solution. So in your case, unfortunately, I'm very sorry to hear, is bereavement. But imagine I have, for example, disability or some disease I have to go in for regular medication, or I have somebody to care for and I can't abandon them. Anyway, that means that I have a lot of duties that isolate me from a lot of things I want to do, and I still feel lonely. So those things, have their own process and their own answers. So there's two aspects, I think, to the solution. Like you said, there is one aspect in being engaged in service to someone else, and making sure your time is somehow occupied with positive action and positive, fulfilling behavior, as well as that personal reflection through prayers and meditation. The other is to unfortunately understand that situation that one is in that case, loneliness, has in its own requirements and stages. So you probably are aware that, I'm sure you sounds like you are aware that there are loneliness counseling kind of systems in the US. Certainly you would have them, and they would tell you that bereavement goes through stages, and unfortunately we just go through those stages, and being aware and understanding those stages helps us in coping with them and finding solutions to the individual stages we're in. And yeah, I'm not sure we have the time, unfortunately, and it's not really my expertise to go through all of those, and what does one do during each stage. But it is important to see to the particular issue that is causing the isolation and loneliness, as well as the generic approaches that can help us through that journey, which is the ones that I mentioned. So, yeah, I don't know if that helps very much, but I think, as I say, in your case, it will be understanding perhaps this process that you're going through and how the different stages can be helped in very practical ways to help. I mean, you know, it's not going to, unfortunately, bring the loved one back, but help us to cope with that situation better.
Thank you. Thanks.
I'm sorry that's not very helpful, perhaps.
No, good. Thank you.
Thank you very much.
So actually, this may be very pertinent to the question Furuz asked about, if I understood right, my experience with the Baha'is in Iran. So I left, as I said earlier, Iran when I was a child and couldn't go back like many people of my generation for many, many years. So I went back after about 17 years. I was one of the first people to go back to Iran after the revolution as a Baha'i. I really didn't know at that time, we're talking about 94, very much about the situation because we didn't know very much detail other than they're very, very persecuted. And as you know, the Baha'is in Iran, I'm sorry, I don't know who knows or who doesn't know about this, but just very briefly, Baha'is in Iran since the revolution 1979 have been very severely persecuted in waves of severity. And it has at times been executions, it has been sackings, you know, pillage of people's properties, and even damage to people's graves, and all sorts of different levels of persecution that is sort of mindless, really. It's difficult to comprehend. But the whole community of nearly 500,000 people have been oppressed for now nearly half a century. In many different ways, including that the young people cannot go to university or colleges, in some communities, not even school easily, and that they can't be employed by any kind of government agency, school, health system, anything. And often when they are employed by a private business, even that business receives letters that they must sack them. If they have their own business, often that business is attacked or somehow, if you like, obstacles put in their way and so on. The Baha'i International Community, which is an NGO, a charity working with United Nations, has been working with Human Rights Commission to help the condition of the Baha'is of Iran and bring awareness about their situation. They call the reaction of the Baha'is of Iran constructive resilience. And that's a very interesting term. So, you know, what I was saying earlier too is, I'm not sure, is it Ferry? It comes up, Ferry's phone, the lady who just asked
Yes.
the
Yes,
lovely
Ferry.
comment. Yes. So as I said earlier, that every one of these conditions that we had on that diagram has its own particularities. So bereavement has its particularities, this disability has its own. And in this case, discrimination of a whole group of, you know, people in a country, huge discrimination, extremely overt, as of course has its own problems. And, you know, just saying service to others may seem that it is not going to, you know, take away that basic disadvantage that they're all experiencing. But what is really, really incredible, I mean, I felt so humbled when I went to Iran. I've been a few times to Iran. I haven't recently, to be fair, in the last 10, 15 years, but before that, while my parents were alive, I was coming and going as much as I could, I suppose. My personal experience was that this was an incredible community, that instead of turning if you like, violent, you know, which many persecuted communities, they feel they have to retaliate, they have to react. And certainly was none of that. I never heard in all my trips and meeting people who just come from prison and being, isolation, imprisonment, and all sorts of torture and problems, any words of resentment, of abuse towards their abusers. There was such an incredible communities development within the Baha'i community that was oppressed, that is truly inspiring. It is a pity that our media is not in a shape to, report positive experiences of human communities. But this is really, truly, I think, beyond this world. So I give you a simple example. My father passed away, and then my mother passed away. Neither of them wanted to leave Iran. And when my mother passed away, I'm an only child. So there was nobody there to do anything for her. She had two sisters who were elderly. And essentially, the Baha'i community took over. I was in the UK and Afghanistan at the time. I was living in Afghanistan between the two countries. And I just got a call that my mother had passed away. I tried to get there. By the time I got there, 2 days later, this local oppressed Baha'i community had got a list of 300 people to go to the funeral, 3 buses booked, the whole ceremony arranged for the funeral and for a remembrance meeting the next day that took place in her own flat, set up by total volunteers from morning till evening. I think 5 rounds of meetings they had, so altogether 350 people attended, Baha'is and non-Baha'is. All was done through volunteers. All I had to do was pay for the refreshments. They had a committee. This is just one example. This is just one part of Iran, one example. They had a committee of young people who had portable cups and saucers and chairs, and very organized. They all knew what they were doing. Certain people make tea, certain people would make the program, certain people wash the body, certain people dug the grave. Certain people did all those things from the day she passed to the day that she had her remembrance meeting. Even the speaker didn't even know my mother very well. She had met her only like twice. But there was this erudite, incredible lady, and that really reminded me of my mom when she was that age. Giving this incredible speech about somebody she barely knew. And I had hardly given any background. They had just got that all within themselves sorted. I was a guest in my mother's funeral. It was just unbelievable situation. I don't think there is anything like it on earth, really. And there's one thing saying I do service by putting the bin out for the old lady next door, than to say I go and wash somebody else's body for free. That's my service. It's quite a different thing, And this is a community that is attacked daily. People are imprisoned, people are tortured, their wealth is taken away from them, their homes are taken away from them. And other simple, basic things, like in '94, I went with my husband, who's English, and we met my grandmother, who passed away shortly after that. She was 94, I believe. She was bedbound, but her brain was all there. And this was at the height of Baha'i persecutions. And she said, oh, it's wonderful. We have small meetings, but these young men come and they put me on their shoulders because I can't walk. And they take me on their shoulders. They take me to the meeting. I don't miss out on a thing. And this is, again, as I said, at the height of persecutions. And these meetings were raided. People were taken to prison, sometimes executed. Service takes a different meaning. This doesn't mean their persecution has gone away, going back to what I was saying before. It doesn't mean that their problems are all solved. But what it means is that actually they have something far more precious than a lot of other people around them, which is a service-orientated community that empathizes and reacts to the needs of that community. There's so much I can speak a whole day about it, but I call it a civilization within a civilization. As I say, a whole bunch of professionals who lost their jobs are offering lawyering service, medical service, teaching service, you name it, to each other. And it's just absolutely incredible. For half a century, this has gone on with absolutely no violence or retaliation. It's totally inspiring.
Thank you so much for sharing this with us. We have a question, and I know that Alice raised her hand. Alice, you will be next. Assistant Professor Akshaya, where are you joining us from?
Hello, very good morning, ma'am. I'm from India.
Hello,
Welcome.
nice to meet you.
Yeah, nice to meet you too. And what a wonderful presentation. Thank you.
Thank you, very kind. Thank you very much. Do you have any point you'd like to contribute or question, please?
Yes, may I?
Please.
Yeah. Okay, I thought somebody else is in the queue to ask a question, so I was just waiting for my turn. Ma'am, I mean, have been listening to you for quite some time, and I'm so much overwhelmed by the experiences that you shared about how the wonderful Baha'i volunteers went out of the way to help your mommy as well as your grandmother. So it is like, no act of kindness, no matter how small, is ever wasted. So this is what is the beauty of service, and Baha'i community worldwide has been engaged in such unparalleled humanitarian acts. And this is my reflection and comment. And my question is, as we're talking about isolation and international commissions being raised to help people fight isolation. Uh, as I'm an assistant professor and I'm also into humanities and international fellow of peace and nonviolence, so I often observe one thing, ma'am, that is when people are depressed or they are anxious at the level one, depression is at a very extreme level, they are not ready to meet the psychiatrist or the counselor. They are unwilling. And I also did lots of trainings with the police officers and military here in India. So that is what they shared with me. So since you are a specialist in this domain, so how do we convince them to visit a counselor or a psychiatrist? They are just not ready. They are suicidal. They meet with accidents and all sorts of terrible things happen to them, but they are not ready to visit a counselor. So can you please guide us a little bit about it? Grateful to you once again.
Yes, thank you. Very good question. Thank you very much for your question and for sharing your very precious experience. I think you're probably more qualified to give this talk than me. That's wonderful. I'm actually not an expert in mental health, as I said earlier. I sort of came to this through the request of this Isle of Man mayor. But my experience just as a medic and as somebody living in this world, I suppose, is that actually, I don't think you necessarily, I mean, it depends on the individual, right? If they actually have mental health condition, and they are in denial, then that is very, very difficult to deal with. And it's mental health condition that requires medication, and how you go about that is, as I said, not my field. But if it's just an individual who's simply lonely and could do with some counseling, then I think all the things we've talked about is probably a better approach for someone who doesn't want the label of having to go to a professional, is what you're saying, right? I might say, well, I'm not a bipolar depressed person, or, I'm not sort of medically mental health difficulties. I just have some depression from some event in my life that, if you like, reactive depression is what we call it, that has perhaps made me lonely, or even not lonely, just depressed. And I understand actually, even whether there is a counselor or not, a better way is a social kind of approach to it. The problem we have is our society is not always orientated that way. And sometimes in some communities where there are, if you like, families live together actually it's very difficult to escape that environment that caused the depression. But really, you know, I think it's very hard to make people go, but you could create an environment where those people are in effect getting counseling without the label. So there are people that call these kind of interventions in far less informal way. They don't call them counselors, they don't call them doctors, they don't call them clinics, they just call them, you know, self-help groups or peer groups or just coffee morning or something like that. So those are approaches that are more, if you like, less stigmatized and so easy to people to take part in. At this, that's my immediate response. As I say, I'm not a professional in this field, but
No, I think this is very well answered, ma'am. And I thank you so much for this
no, not
suggestion
at all.
that they
Thank
can
you.
go to self-help groups or, you know, without a label. Thank you so much for that suggestion. I really appreciate. Can I request you to share your email ID or contact in the chat box, if you don't mind?
Yes, I will do. The only thing I would say is I get so many emails. If I don't know the names, unfortunately, sometimes it takes more than just if you like, just an email for me to be able to respond. So I'll give you my work email, which I check more regularly.
Sure.
But if you don't hear from me, perhaps my number is there. Maybe send me a text or something.
Oh, that will be great.
You can, yeah, you can get this. Usually get some response from it anyway. Thank you very much for your input. It was very interesting to hear your experience and very important question. Thank you.
Yeah, I'm grateful to you for the answer and thank you to the host as well. Thank you once again.
Thank you.
I think somebody in the chat wrote that he or she wants to talk. It's iPhone. Also Alice raised her hand. Alice, would you like to comment, or do you have a question?
Thank you so much for the presentation. But you know, as I sit and listen, we as I won't say we are minority race, but when I came up, we do not do counseling very well. I have a daughter, she has a PhD, she's a psychiatrist. But in the Black community, we don't. That's almost unheard of. And we do have a way to cope with that loneliness, a little different from white people. We talk about our relatives that passed away. We do have conversations on the person that passed away. I know that my white friends, they don't talk about the person. The one thing I learned through losing my son with that, you're never going to get over it. And I don't want somebody to tell me to get over it, because you never do. Because once you lose a child, that child is always with you. You just have to learn how to cope. And that's the one thing I do have still as a Baha'i, if I'm having really some issue or depression, and everybody have some at one time or another. But there's a way for us to release our depression, because we go to church, we have worship, we shout, we can holler, we can run around the church if we want to, and nobody's going to say anything.
Yes.
Baha'is on one of these programs, they hear any noise, they go, somebody got their Mac over, some noise. They very sketchy when it comes to noise. But as a Black person, no, I don't go. And even my daughter she's a counselor for the state of Michigan, all that kind of stuff. No, I'm not doing that. I tried that when I lost my son. When they talk about grief, it's not my way of doing it. To be honest about it, it's not my way. If I need to cry, let me cry. And you need people to be there if you cry, not running over, hugging you. Don't cry. You just need to have someone there and let that person cry. Allow them to express themselves.
Yes.
That is what it all comes to. Even if you go to a counselor, I gone at first when I lost my son, they would just drove me then gone crazy. You cannot forget your child.
No, absolutely.
If you living in that house where this child as my child lived in this house, things happen in this house. The door may close. Somebody may leave. I know people moved out of their house, but a lady, foreign lady, Caldine, when I first lost my son, I was moving out of this house. She told me a story not to move out of the house because she said his spirit come and visit, and you move out of the house, you won't be there. That has kept me in my house. My son has been with me up into the last 2 years. He's been gone 23 years. And I have learned now to release him in the last 2 years. He was always here with me. So we have to need to learn how to allow people to grieve. You need to make it okay to grieve. That was your loved one. That was someone you love. You cannot detach from that loved one. And then coming back to this Baha'i faith, the most beautiful thing about that is detachment prayers. When you detach from your child or whoever you lost and you give it all to God and accept God, how you going to be detached from that person? Because God holds all of us in his hand. So if he's holding everybody in his hand, you can never be without your loved one. And when I come to this Baha'i faith in 2001, I had a privilege to teach English to the Persians in there that going to school. I know how much of persecution that went on there in the 70s. I had the opportunity. If it had not been for me doing that work in this faith, I would leave the faith. I am so connected myself, personal to the Persians, Iran, Iraq. I know what went on there. I had students that went to jail. I had students that got killed. I did the work from 2002 till 2010. They call University in the Sky. So I have great connection with that. And some of them had said to me, are we in America, if we prayed and did the prayers, and it's going to make me cry a little bit. And that's why I'm up doing prayers 3 or 4 hours a day to help. And they felt that would help. And I've been doing this for years, doing the 5 tablet, the tablet of Ahmaz, every day. Because if we in America don't think of the Persians, Iran, Iraq, the Baha'is that's there being persecuted, we are not. We have no idea what it's like. We have freedom. So I say to my fellow people, let's pray. Pray. Say those prayers. You got prison prayers. We got every prayer in the Baha'i prayer book.
Yes.
So we need to pray those prayers. And
Alice, Alice, my love, it's a little late for her. Probably it's 1 o'clock in the morning.
Oh, I know.
No, don't worry. Actually, I was going to say, Alice, thank you so much.
It's
That
2
is
o'clock.
also true. Your advice on bereavement is bang on. I think it's absolutely right. We live in a society that doesn't like, at least in the West, we don't like to talk about the dead. But actually, in the Baha'i writings, we're told to talk about the dead. You know, if I can share an experience, the last talk I had the privilege of attending of Ruhiya Khanum, the wife of Shoghi Effendi, one of the central figures of the Baha'i faith. She came and gave a talk in London soon before she passed, well, almost before she passed away. And I was a youth at the time. One of the things I remember most vividly is that she said, two things I remember very well. I'm sure she said many other things. One, she said, please carry on being hospitable. She said, you know, it's really good to be hospitable. It's our duty to be open our house or whatever humble way we can, even with a glass of water. The other thing she said, talk about death to people, about the Baha'i concept of death, that people are afraid of talking about death, and that itself is disabling in society. So what Alice was saying actually is my also experience in Iran. Again, if it's of any help for anybody who's had bereavement here. You know, when I went to Iran, obviously there were people who'd lost their family members due to execution. And it was all very recent. And you can imagine execution is probably I don't know, is it worse or what is it? You know, way of losing a loved one. You may never have even their body. Some of those people were asked to pay for the bullet that killed their loved one. All sorts of crazy things that you can barely imagine. But what is amazing is this concept of detachment that Alice talked about. Thank you for doing that. It doesn't mean that you don't love your loved one. It doesn't mean that you don't think of them daily and that you don't pray for them. Sometimes we are closer to the loved ones we have lost than we are to the ones who are alive because they are physically so far away, we rarely see them. Whereas the ones that have passed away are with us daily, as you said, Alice. So it's not that, it's that we understand that death is not the end to life, that whoever you are, that the next life is better than this. And that, as Alice said, that our loved ones are in the embrace and in the arms of the beloved. Especially if they've just been, you know, a good person and just done their best as best life could give them. So I think, but as you say, the reality is that, you know, our loved ones are always going to be there. And it's not just about bereavement, as I said earlier. Every condition in that diagram that leads to loneliness has its own requirement. You've got to find a way that somehow removes us from the core cause of that thing. Anyway, I don't want to repeat myself. Thank you, Alice. That was very helpful, actually. I really enjoyed it. Thank you so much. Maybe our lovely colleague or friend here, iPhone, I think you put your name down.
Yes, iPhone, please. Where are you joining us? iPhone, please go ahead.
Alapa, is that me you're asking to
Yes,
speak?
hi.
Hi, Alapa. First of all, I'm really happy to meet you. I'm calling from Perth, Western Australia, and that's where Roden is, your son.
Yes, it is.
And
It was. He
now,
just left. It's
yes,
Patricia, right? Your name is Patricia. Hi.
Patricia, yes, that's my English name. I'm Persian originally. My Persian name is Parvane, which it means butterfly.
Yes.
I can see where Rodin gets his kindness and caring character and the smile.
Oh my goodness, that's very kind of you.
Yes, here is morning and Friday morning. My question is that we have started this Baha'i Society at one of the universities about 4 years ago, and is increasingly getting bigger, and it's quite enormous now. We have a lot of Baha'i activities at the university to state that we don't have enough volunteers and we need helpers. So I am constantly asking and requesting the community members to help, but there isn't very much success. I was just wondering that with your profession, and as Rodan has told me about your travels and experiences around the world, if you were able to give me some hints and some suggestions, how can I motivate friends to help us?
Well, I don't know. I think that's a $100 question, isn't it? A $1 million question. I don't know if you can. I'd tell you the honest truth. I don't bother. So at the university here in Birmingham where I work at Birmingham University. I do my own thing. So, and I try to do things that don't need a lot of other people and accept, detachment, what Alice was saying, the circumstances we're in. I mean, in Perth, you have a lot more friends than we have in Birmingham. We physically don't have enough friends. But for example, we have, well, maybe out of this meeting, we can have a chat about that because I'm not sure everybody here is into that Baha'i Society
Sure.
University. But yeah, it's a passion of mine. I'd be very happy to talk about it. But perhaps if you don't mind, over a weekend or some other time when we can talk properly, I'd be very happy to talk.
Thank you. How can I connect with you then?
So if you have, as I say, well, I'll tell you what, I'll give you my WhatsApp here as well. Or maybe you can,
Yeah.
hold on, where are we?
Please share your WhatsApp if you don't mind.
I can put my email, and if the friends would like to email me, I can direct them to you, or if I could be of any help.
Yeah, I'm happy to be directed. I think that's probably the easiest way. If Parvana Patricia Jan, if you can please contact Furuz, she'll give you my number.
Okay, all right. Or maybe if that's
I would
easier.
be very happy to talk. This weekend, unfortunately, I can't on Saturday, but Sunday I could talk if it's useful.
Yes, sure. That would be great. Would it be easier if I connect to you through Rodan or?
Yeah, that would be great too. He has my number. Yeah. No
Okay.
problem.
All right. So I'll ask him. He's got my number. Okay. So through him, I think it's easier.
No, I'd be great. I'd love to talk about Baha'i Society. It's a thing I do.
Thank you. I'm
Yes,
so
I would
happy that
also.
I met you.
Yes, I would also like to communicate to you about how we can motivate people to be volunteers. So we all can discuss it maybe when ma'am has time, when Semira ma'am has
Yeah, sure,
time.
sure. I mean, volunteering for different things is different. So, yes, sure, we can. Actually, could I ask you, where are you in India? Because I actually come and go with India with one of my projects. I'm working in Bihar.
Oh, really? That's lovely. Well, I'm from India and I'm located in Delhi. So I keep traveling to Maharashtra and
Okay.
Delhi. Sorry,
I'm coming
I'm.
to Delhi
Oh,
in beginning
wow.
of July. Maybe we
Oh,
can meet
that's
up then. So
amazing.
if you could kindly message me, I
Yeah,
get my number
sure.
from Furuzjan, and then maybe we can meet up. I'd love to meet up. In fact, you could help me
Yes.
tell my friends and colleagues about the faith.
Yes, of course. Why not? I would really love to do that. So I will take your number from Madam, host
Yes,
Madam. Is
thank you
that
so
okay?
much. Yes, thank you so much.
I put
Thank you.
my email address in the chat. Friends, it's already 9:20. I wanted to welcome Gary. Gary, thank you for being here. I appreciate it. If the friends would like to connect to Dr. Manaseki-Holland, please send me an email and I'll be in touch with you. I wanted to say something else, but I somehow have forgotten. Alice wrote a beautiful thank you in the chat. She said, "Thank you, Dr. Semira. Thank you, thank you, thank you." And Assistant Professor Ashkia said, "I look forward to meeting you." Friends, I am elated that Semira accepted to be with us tonight. look at Alice, how she is smiling and how she is nodding her head. That's wonderful. You see, the hearts get connected. It doesn't matter where you are. You see? Thank
Yes, it's amazing. You know, COVID brought this one, certainly this benefit across the world to unite us all like this. We never had this possibility before. So from every crisis comes a victory.
That's
This
true.
is one of the victories of that one crisis, unfortunate crisis. Yeah.
That's true. That's true. We're going to have a few prayers after that. Semira, you're tired, and I understand it's probably 2 o'clock in the morning for you. If you would like to stay for closing prayers, please feel free. If not, I wanted to really express my gratitude to you for sharing all your knowledge and experience and memories and everything with us tonight. Thank you so very much.
Thank you. Thank you really, Farijan, for the opportunity to do this talk. I really enjoyed it, and it's a real privilege to do it. Actually, it's quite special waking up in the middle of the night to give a talk. So thank you so much. And I do apologize that I got the times wrong. It's my Google that is at fault. I'm blaming it. I tried to get the time right, but I do apologize. I kept you waiting. Thank you all for waiting. Thank you so much.
Thank you so very much. We look forward to the other fireside you have about women and peace
Thank you.
in future. Thank you.
Thank you. Take care.
Take care. Bye-bye.
Bye, everybody. All the very best.
Bye.
Thank you.
Thank
Uh,
you. Thank you so much. Thank you.
we
Thank
would
you.
Thank you to the host.
we would like to start our prayers. Gary, Alice, Josh, almost everybody. Could we start with Gary and also Alice? Last session, last fireside, I forget the name of it. You sang. What was it that you sang, Alice? You don't remember? It wasn't the Baha'i song.
Amazing Grace.
Amazing Grace.
Amazing.
Who was this? Isabel, you're a genius. Who was that? You're a genius. Okay, so why don't we start with Gary? Gary, thank you for being here. Gary, I know you have guests, but it doesn't mean that you can't say prayers. Josh, don't go anywhere. Let me